So we will go ahead and take Erica, they, them pronouns from California, wants to ask us if we can give advice on the denial of gender affirming care. Erica, please tell me what you would like to talk about.
Oh, I just wanted to. I don't know if this is a good subject for this show or whatever, but I just been trying to get some advice and some resources as to where or what can somebody do. I live in California, and they talk about how like pro transgender and everything it is, but it's really not like that. And I just wanted to know if you had any advice or knew of any resources or anything for somebody who's having trouble getting like their gender affirming care through like insurance or through um like government assistance like Medi-Cal
Sure.
or whatever, like Medicaid or something
Sure.
like that.
Absolutely. In most major cities in California, you have a lot of queer centers, and even in smaller towns in California, there are LGBTQ centers that exist that are community centers. A lot of them have transition healthcare like specialists that are there to help navigate these type of things. I know in California, Medi-Cal still covers gender affirming care, so you should be covered. I know a lot of friends who live in California who receive their care that way. So I would definitely try your local community center. Either it's called a LGBTQ center or it might be called a Pride center. In certain cases, I think that is a first step that you can go to. You also have different organizational groups like Trans Equality .org, which is the advocates for trans equality. They have resources and guides on how to start navigating the healthcare system. And there's also organizations like the Transgender Legal Center that also have resources that can help you get those type of care as well. And also, if you already have a primary care provider through any of these systems, you can also go to them and tell them that you are needing this care. And also, you can go to Planned Parenthood. Planned Parenthood is actually a really great resource to go if you are lower income and need assistance in getting hormonal care. Planned Parenthood is actually a large distributor of hormone care for trans individuals, and Planned Parenthood is actually quite representative in the state of California. Um, have you tried any of? Does those sound like a good start for you?
Yeah, like I have a response to that,
Sure.
which would be two things.
Sure.
So like I am familiar with Planned Parenthood, and there is a lot of like trans specific clinics, or at least even a lot of places have like trans specific departments within the clinic. And it seems like that would be helpful, and I'm sure it is to a lot of people, but it seems like when you get into the more so like hormones and everything, you're right, Planned Parenthood and most clinics for sure, like there's pretty good access to that part of gender affirming care. But when it gets into the other kind of parts of it, like I don't want to get too specific, but
Sure.
like the more developed stages of of like transitioning or services like
Mhm.
surgical or
Mhm. Hair
dermatological,
removal. Yeah.
Mhm.
yeah, stuff like that. Um, it just seems like there's a lot more pushback, a lot more red tape, and so like it's there, but it just seems like and just for me in my situation, like I'm not able to like this, and I don't know why exactly, but I'm just not able to get it. It's covered, but I'm just not able to to get access to it. And I'm not not able to find. There are like a lot of advocacy um, organizations and stuff like that, but when I contact them, they're more so like, we'll just push you in the right direction, or we'll give you advice on
Mhm.
maybe something you could do, or we'll just kind of redirect you the back to the back to the avenues that are already in place, like grievances or insurance, or just, like, so I'm just kind of
Yeah,
being thrown into a cycle, and I'm not getting anywhere. And it's kind of been a while that I've been dealing with this. And like I said, there's no clear reason or anything like that. So I was hoping like I could find. I've been looking, but it's just not been helpful. Like for an advocacy organization or somewhere where it's like, listen, I'm really being redlined or something like that. I'm really
yeah,
being denied services. Like, and and it's been going on for a while, and so it's something really like uh, that I'm not getting any answers to, and it's
I
something that
understand.
I'm not able to find a way to get past or overcome. So
Absolutely,
yeah,
and I don't mean to kind of be like, "Go in this route." I will say
yeah.
there is a certain word that you need to be asking for when you go to, like, a local say you need a trans healthcare coordinator. You need to talk to a trans healthcare coordinator is the words you need to say, because a trans healthcare coordinator at a queer center like, a pride center, or even at Planned Parenthood, you need the whole complete care, right? That's what you're looking for. You're looking for complete care for all of your transition related needs. And you're right, the medical system in America is garbage. The world around knows that medical health care in the United States is terrible and doesn't provide the care that we need, especially for the folks that are lower income. And it's not fair, and it's not okay, and it sucks that we have to go into this circle and keep advocating for our care a million and a half times before we find the person that's going to support us and help us in this way. Um, I wish I could give you more, but I would try and start looking for trans healthcare coordinators that can help you navigate the system, because not everybody knows how to navigate the system, nor should you have to be able to navigate the system. But there are professionals out there that are good at doing this type of work. Um, I know that's not the best answer I can give you, Erica, and I'm so sorry that I could not give you a better answer. But I would try going to the people that provide that healthcare, and you just need to ask: Is there a trans healthcare coordinator that I could speak to help me navigate my needs for the healthcare system?
Okay. And do you know any like? Are you aware of any like organizations maybe that I might be able to contact where if I tell them that this is like an ongoing real issue, and and they're not trying to like they're just not it's like they're not it's like a door that they just won't open for me, like like they're just not trying
Yeah,
to give me what I'm entitled to. Do you know
yeah.
any organization that I might be able to contact who can maybe assist me or on my behalf or something like that?
Unfortunately, I don't have anyone in the top of my mind, but your local community centers are your best bet, because they know the local area. Because a lot of times healthcare is localized. So you're going to have to be
Mm,
able to go to those areas. But if you go to a queer community center that actually is there to support the LGBTQIA plus community, and you say,
mm,
hey, I need help navigating trans healthcare so I can get my
mm,
complete transition related healthcare, they should be able to point you in the right direction and give you phone numbers and say, "Hey, I want to make an appointment. I want to make an appointment with a trans healthcare coordinator. Can you help me find somebody to help me navigate this?" And usually, if you
mm.
say those things, they will try to help you. I can't speak because I don't know where you are in the country other than just California, but I know LA has
Yeah,
these,
the
San
Bay Area.
Francisco. You're okay, great. You're in the Bay Area. So
Yeah.
you're in better shape than most. Try to find your local queer community center and just go in there and just say, "Hey, I need help." and they will have a phone tree of people that will be there to help you.
If
Okay?
you need to look up pro bono legal services, like if this is a situation where you know that you're entitled to the care and like someone is just not giving you a referral that you need, if you need a lawyer to draft a letter that says, "Excuse me, my client is entitled to this health care and they're being given the runaround and they've been being given the runaround." Um,
Mm.
I'm just like amongst the other things you could look into, that is potentially an option. If you're like, I know that this care is covered or should be covered, or should be taken care of, and it's just a bureaucratic runaround, which it kind of sounds like is what you're dealing with, then it's possible you might
Mm.
need someone to write a sternly worded letter for you.
Yeah.
Mm.
And I would definitely try the community center first. And if that is a dead end, then I would definitely recommend what Lux is saying. And I would contact the Transgender Legal Center, TLC. They actually
Okay.
are a huge organization and they have that type of service. So,
Okay.
okay. I wish you the best of luck. I really do. I wish I could help more, but that's basically all I can do with on where I sit here in the show.
Yeah.
Okay,
I just want to say, can I just say one more thing, like just a comment?
sure, sure.
Um, I just think that it would be cool, like as far as a community, trans people or queer or whatever, however you want to define or label the community, or like, and this goes for every minority community. I think that it would be cool if people who are serious about their community would work together to put something together for situations like this, instead of just waiting to come out and be loud and vocal when the cameras are on, or when there's a big tragedy, or
Yeah,
when it's convenient, or when it's easy, when there's a momentum behind it. Because there's like a lot of people who just need like that. Like, where can I go? Where can I go? Ask like somebody who
yeah,
knows what they're doing, somebody who knows how it works, so they can just do something like write a letter on my behalf and just quickly just boom and get me out of this situation. Because so it's like sometimes when you get stuck in one situation, that puts you at risk to get stuck in another one and another one, and then it's like it's a tragedy. Then everybody wants to talk, come help, and this should really be something to
I agree.
try
I,
to prevent all that. Yeah.
Yeah.
I agree, and that's why go to the local center because you're there and the people who are trying to support people are local. They're there, they see you, you're and that's what they're there for. And I wish we
Right.
had more resources to fund all of these local community centers. I wish we had one in every township in the entire country. And
Right.
and it's unfortunate that it's a localized in a lot of ways. But I 100% agree with you, Erica. Yeah.
Right. And you said it
Well,
was called the
best
did you say it was called the Trans Legal Center? How you called it?
yes, the Transgender Law Center.
Mhm.
Oh, okay. I'm gonna go for that one. So I appreciate it.
Okay, sounds good. Yeah, for sure. I know a lot of
Good
good
luck,
people there. I
Erica.
work with a lot of them. Yeah, good luck. All right.
All right. Thanks.
Bye.
Hey, thanks for watching that clip. Did you know we saw what you were doing when you watched it?
You saw all of it. All of it. All of it.
So you're going to want to pay us hush money over at patreon.com/calltheline, where you can buy our silence and watch our patron exclusive podcast.